Testing for insomnia and sleep disturbances. Sleep is essential for life. It is restoring and repairing the body whilst you're asleep. Insomnia is really a very common phenomenon. It's defined mainly as a persistent difficulty in ability to either fall off to sleep, which is sleep onset, or maintaining sleep, which is sleep latency. Ongoing sleep impairment interferes with normal daytime function, of course, and the amount of sleep required by adults is slightly longer than 8 hours. So insomnia is really classified as either chronic, if it persists for 4 weeks or longer, and there are two main types of insomnia. One is delayed sleep onset, in other words, difficulty falling asleep, and this is usually driven by melatonin, which is a precursor or a metabolite of serotonin. And then the other one is some people have tendency to, they fall asleep okay, but they have problems maintaining sleep. And these are patients that these frequent awakenings or early morning arousal, difficulty staying asleep is associated usually with other neurotransmitters, usually GABA as well as dopamine. So to identify and test for insomnia and find out what's actually causing these sleep issues, one might examine the adrenal function. So that's cortisol as well as melatonin at about between 12 midnight and 2 a.m., usually around 1 a.m. But you would need to sleep like you normally do and then put the alarm on to collect your saliva sample to identify both the cortisol as well as melatonin. However, you can, in a urine test, you can identify melatonin throughout the day as well as cortisol throughout the day. But to me, I find that it is very important if people have sleep issues, you can identify what's actually the driver behind it, what's happening to the neurotransmission pathways prior to production of onset or latency of sleep. So identifying your neurotransmitters such as serotonin, GABA, dopamine, noradrenaline, adrenaline, and so forth are very important to identify what's actually driving that insomnia. So if you like to determine which test is right for you, please speak with your healthcare professional, or you may want to contact us to order a test, interpret your results, or even seek guidance on your health condition. To learn more, check out our Learning Center for in-depth education on this very topic. Thank you.